Hello, everyone. Good morning, good afternoon, good evening, where you're logging in from. This is IRS Group, and my name is Milen Jacob. Welcome back to yet another OET All-Star session. And if you're able to watch me, listen to me, please type in the chat box where you're logging in from, which country you are, and if you're sitting the OET test soon, I'd like to know that as well. So welcome, everyone. Here we go. Yes. Excellent. So we just had a heavy monsoon shower this evening here in Kerala, in India. But I will be discussing OET writing with you in spite of the warm temperature and facing a power outage at the moment. Great. Beatrice. Hi. Dhatraka. Sidra from England. Suha from KSA. Hello, Rahul. Charti. Beatrice. Hello, everyone. Great to see all of you. Charities from Zambia. Hi, Shiji. Suni, hello. Saboy. Vasanti from Sri Lanka. Sandra from Bahrain. Pavitra from Sri Lanka. Hello, Shiji from India. Mohammed Yasin from Turkey. Baby Jovi from UAE. Joanne from Qatar. Suni from Saudi Arabia. Stabil from Zambia. Hello, everyone. So I'll be going through some of the key aspects of OET writing, which will help you in acing the test with a great score. So today's topic is how you're going to convert case notes to letter, keeping the accuracy intact, right? So you can tell me what are some of the challenges you face in OET writing. I'd be happy to discuss that as well. Here we go. I'll be looking at your comments as we go. Yes, more of OET candidates, health professionals are logging in. Maggie from Kenya, RJ from Oman, Milen from Spain, Kosor from Kuwait, Kalai from UAE. Hello, everyone. Vijay from Delhi, Prissy from Ghana, Bagday from Tirupati in India, Ajay from Ghana. Hello, everyone. Yes. Sorry if I missed some of your names as we go. Mukul Chaturvedi says organization of letter, right? Yes, that's another topic altogether, but definitely there will be some key points on how you can keep organized. Right. So now I'll be discussing some of the key aspects of transposing the case notes into letter. First, we'll be looking at some very explicit aspects of it, but then later we'll be going into some abstract concepts as well. So one of the first things that I want to discuss is how notes become complete sentences. Here we go. Now, I'm going to head into a short activity, but I'll show you examples as we go. You can try it yourselves. Now, you have a snippet from a case note, which I want you to convert into a sentence. There's a whole lot to cover, so I'll be a little bit fast, but I'll follow you in the chat as well. So try converting what you see on the screen into notes. Hello, welcome. Gopika, Shiji. Shiji says finding known or unknown cases, right? Ramesh from Hyderabad. Rakia, Chrissy says layout and organization is a challenge, right? Okay. So as your sample sentences come in, I'm going to show you my example. So Ms. Mira Fernandez was diagnosed with right lateral epicondylitis. And so now you have seen how this has become a sentence. Now I'm also going to show you another sentence based on the reader awareness. In case you're not writing to someone who understands the condition, the clinical terminology, epicondylitis, you will have to, tone your vocabulary, your register down a little bit. So it can be Miss Mira Fernandez was diagnosed with tennis elbow on her right elbow joint. It depends on the reader awareness. And there's another session which I've done in the past. You can find that in the OET official YouTube channel on writing with the reader in mind. Please go through that as well, so you'll get a better idea on what I'm trying to tell you. Okay. Now, the second important aspect which troubles a lot of candidates is how to deal with symbols. So let's look at some examples. You can try this. Sandra, Maggie, Christine, Chrissy, yes, I'm going through your examples. Excellent. I want more of you to type in your responses. Doesn't matter if it's wrong. And I'm afraid I may not have enough time to correct every example you give, but still it's a good thing for you to be doing. So here are some words. It's the intermediate step of transposing notes into sentences. Think of the words first, and then frame a sentence. Keith has experienced increased pain in his left arm. So now you look at the note which says or shows an arrow, pain in L arm. And now you have a full sentence. Here's another example for you to try. And you have a symbol and an abbreviation. Right. So as you know, it's a query. Here are some words which you can use to indicate the query. Suspected indicates indicative of possible, and STML expanded as short-term memory loss. Here comes the sentence. Chris' symptoms indicate possible short-term memory loss. Therefore, I'm referring him to you for a definitive diagnosis. Now, this is something that you might see quite often in OET letters. So it could be a query, a provisional diagnosis is made, and you are referring for a definitive diagnosis or for the confirmation of the diagnosis you have made or your impression. Now, of course, there's a slight, ambiguity about the term impression, because in some clinical contexts, it's it borders between a query and a final diagnosis. So, great. Let me look at some of your own responses. Yes, that's right, Gopika Nezeni. My apologies if my pronunciation isn't accurate. Maggie, yes, that's good. And Jay, right, yes. Good, good, good. So as part of the OET All Stars, one of the 12 premium organizations across the globe, IRS Group is happy to give you these sessions to help every OET candidate achieve success. And if you would like to have individual one-on-one classes with us, feel free to contact us. You have our telephone numbers. These are Indian numbers, but we are also available on WhatsApp. And our counselors, student counselors will help you with a demo session, which is absolutely free. So give it a try if you would love to learn with IRS Group. Now, the third aspect is grammar, because the notes will not have anything grammatical. It's devoid of grammar. Now you have to bring in grammar because you have to frame sentences in the letter. So let's see how you can apply grammatical rules and make it great sentences. Okay. I want you to try this. I'm giving you this time to, think, because I know some of you are waiting for my own examples to come on the screen, but give it a try. And that's one way in which you will develop, you learn how to transpose notes. Let me see if some notes have flowed in. Good evening, GB Chaco. Okay. So here is my example. Mr. Matthew will undergo further pathological examinations and he has a review appointment at the clinic in a month. Now, yes, I agree that there's a little bit of addition, but this I've done to give you an example of a good sentence, which you can perhaps try if the context is appropriate. There's another one. Yes, Kenzeni, that's right. Chrissy. You can try this one. Your monitoring of a medication compliance would be much appreciated. And if you look carefully, you're being asked to identify the grammatical structure needed. Can anyone type in what is happening here? Not sure if someone has identified or understood the question. Okay, Diana, that's good. Ramesh, Rakela, yes. So this is called nominalization. Have you ever heard of nominalization? Nominalization is the process in which verbs or adjectives are converted into nouns. And this is an important grammatical feature that you see in formal writing. And this is something which is going to give you an upper edge in grammar. So make sure you know how to normalize properly and also learn where to apply it, when to use it. So here you have a monitor becoming. Your monitoring of medication compliance will be much appreciated. Or if you're asked, investigate. An investigation has been requested. Or assess. An assessment will be conducted. So this is an important feature which you can try and improve your writing skill. Now, the fourth aspect is tone and register. Now, just like grammar, the notes do not show or reflect any tone and register. Does anyone know what tone and register means? You can type in. Because this is an important skill that you have to learn, acquire in formal writing. Have you ever heard of tone and register in writing, in linguistics? Hello, Gamer. So tone could be polite, friendly. We vary our tone in oral communication as well as in written. So can you tell me which of these sentences is polite? Let's see how you can change the tone. Type 1 or 2. Okay, I see a lot of 2s. That's right. It would be appreciated if a community nurse could visit Mr. Arthur daily to check his vital signs and monitor his compliance of medication. Right. And the tone should be professional. What does that mean? Let's learn with the help of this example. Again, type in number 1 or 2 to tell me which of these sentences is professional. Here we go. Again, it is a number 2. It would be appreciated if a community nurse could visit him daily for dressings, mobilizing and administering the medication. Right. Thank you, Suman. Now, another area is being factual and non-judgmental. And the notes will give us a lot of opportunities to be judgmental. So you should be careful not to tread in that direction. So let's look at this example. Miss Emily is overweight and her hobbies are mostly sedentary. Or Miss Emily is obese and she's reluctant to do any exercises. Which one is factual and which one is judgmental? So type the factual sentence, 1 or 2. Right, Gopika, Menaka, Rajkumar, Christine, Maggie, I'm afraid Pavitra, Shahim, Ankita, yes, Sandra, Joanne, Abovers, sorry, Suman, no. I'm afraid Manpreet, yes. So here we go, it's 1. Overweight is considered more factual than obese because when you brand someone as obese, it's better to say overweight. And if the notes give you the BMI, it's absolutely better to include that as well. Not just for BMI, but for any unit given could be included. Drinks 5 units of alcohol or smokes 1 pack cigarette a day is far better than being judgmental, telling that somebody is a smoker or a drinker. And how can you be formal? Of course, we are dealing with formal writing, so the register has to be formal. Now, register is the variation and formality of the vocabulary. So we should go for formal register in OET writing and not informal register. And it's not binary like yes or no. You have a whole range of register from extremely formal to extremely informal. So look at which, tell me which of these examples has got formal register. The vocabulary is more formal. It's very easy. And if you are a student at IRS Group, this is something you learn earlier on. So needs becomes requires, and help has become assistance. So, excuse me. Now, we are coming to some of the final aspects that I wanted to discuss with you, and this is about regrouping of information. So, in a question, in a set of case notes, you will have information across the board. Like typically it's let's say 2 pages of information. Now, someone who is a beginner, not adept in OET writing, will try to write the letter in the order of the case notes. But if you have, learned properly, and if you have become, good at it, you will know when to group, where to group information from different parts of the case notes. So that's also another skill which you should learn to improve your OET writing. So here is an example. Okay. Now, which example has better grouping? Again, type in number 1 or 2 as you think is the right answer. Right? Yeah, I see more correct answers. So what you find is that hypertension, which is somewhere above, is grouped with the medication. And that shows a better control of grouping than listing as it comes in the case. I'm not saying the other one is absolutely wrong, but if you want to show your proficiency, grouping will be really great. You try it. So they splash the screen, but I'll give you a moment to try it. Okay, Diana, if you don't know if it's control, you can say is managed with, or is on something for something, is on whatever drug for whatever condition. That's another alternative. All right, so here is the example. Ms. Miles is an IT consultant who uses computers for the majority of the week. So her profession is grouped with the usage of computers, which is part of the current problem. Finally, we are going to look at accuracy. Can you tell me if the sentence that is transposed from the case notes is accurate or inaccurate? Because as you transpose, as you convert the notes into letter, it should be accurate. And if it's inaccurate, it can lead to loss of marks in content, the criterion of content. But across the board, it will have ramifications. So type in accurate or inaccurate. Okay, if you didn't get me, tell me whether the notes have been accurately converted into a sentence in this example, which you would use in the letter. Okay. It is accurate, yes. Ankita, yes. Many of you are right, but some of you have mentioned it's inaccurate. I don't see the reason why it's inaccurate, but you can tell me why you think it's inaccurate. Now try this one. Yes, I see mixed responses. So here's another example for you to try the accuracy of the transposing. Nukul, I guess you mean inaccurate or right. Now this example is inaccurate. Some of you have written it as inaccurate. Some of you have told me it's accurate. It's not accurate because the prescription is not for 4 times a day. It says it shouldn't exceed 4 times a day. And he continues to take, we don't know if it has been, prescribed previously to say that he continues to take diclofenac tablets, right? So there are 2 areas where the accuracy is compromised. Now, here is the final example for you. This is for you to try. Now, don't hesitate, give it a try because this is a powerful exercise in developing your, transpositional muscles for OET writing. You'll learn how to quickly transpose the notes into sentences. Here's an example. Ms. Bennett saw me today reporting problems with dizziness, headaches, and diarrhea. She asked to discontinue the captopril, attributing her symptoms to side effects of this medication. You can go through this recording later as well if you want to try. Here's another example. Now, this is something for you to do in your free time, and I'm not going to spoil you with an example. So before we wrap, call it a day, I'll take a few questions. Any questions on OET writing or on anything that we have covered today? I'd be happy to answer. I know there will be a slight delay for your questions to come across. So I'm just waiting to see those questions in the chat. Yes, you can use connectors, but use it appropriately. Felistus is asking how to differentiate a discharge and a transfer, right? So discharge would be typically back home or to the place, the residence where the patient did come from, but a transfer would be to another care facility or another department, another hospital, something of that sort. Okay, Anna is asking, as you are aware, yes, you can mention that as you're aware of John's previous history of something, yes. Do Wills is asking, how do you manage time during writing? So when you do a task, try to practice, because you have the 5 minutes of reading time, and then make a quick plan. Make sure you, don't write a paragraph and then go back and think. It would be much better if you already know how many paragraphs you're going to write and what content will be there in each of those paragraphs. That's something you can try, Aju Wills. Okay, Lucky has been, so it's been an ongoing problem, something that, for example, Tom has been experiencing headaches for a few months. So it started sometime in the back and it's been going on, Lucky. Chrissy, I'll go back to the example and I'll get back to you. Jaya is asking how to know what can be written for rehab center and social worker. That's a very tricky, confusing question for a lot of, a confusing area for a lot of candidates. Now, I've heard a lot of people say like, include the social background in the second paragraph, or, if you're writing to a social worker, include all in the entire social history. That's all nonsense. Now, it depends on what information does the reader require. So, for instance, why would you write to a social worker? Is it for assistance in activities of daily living or household chores, or is it for let's say psychological support? So it depends, and then you choose what information they require to provide the specific care that they are supposed to give. So that's exactly what you should decide, Jaya, whether it's to a rehab center or a social worker. And don't go by these templates or people who try to trick you by saying that in this information goes in this paragraph. You cannot absolutely have a predetermined template, and that will reduce your scores. And also, perhaps your teacher doesn't know very well. So they make it easy. I've seen notes where candidates are given examples of letter to social worker, letter to a dietitian. You can't have pre-formatted letters like that. Absolutely not. You have a lucky rough sheet on the back of the sheet. I mean, the writing answer paper. Sailor is asking, patient was admitted for more than 5 days and present similar symptoms with some of the days. Okay, it's not very clear, but you can say something like has been experiencing these symptoms for 5 days, I guess. Yeah. If it's a child, you can say a 5-year-old child. Or, yeah. All right, so that's all I've got time for today. Thank you everyone for having me do this session, having IRS Group help you with your OET preparation. I'll see you soon with another session on OET. Thank you, everyone.